Okay, let's unpack this. You ever stop and think about the sheer complexity humming away inside us? It can feel, well, overwhelming sometimes.
Oh, absolutely. Our bodies are incredibly intricate systems.
Exactly. But today, we're going to zoom in on a set of truly remarkable organs, often the unsung heroes of our internal balance, the kidneys.
The kidneys, yeah, definitely unsung heroes. They work tirelessly behind the scenes. And honestly, it's often only when their function is compromised that we truly appreciate how vital they are.
So true. And for this deep dive, we've got a really interesting overview here looking at renal disorders. It's almost like a cheat sheet for understanding what these amazing organs do and,
Yeah,
well, what can go wrong.
it's like a good summary.
Yeah, so our mission is pretty straightforward. You have a solid understanding of the kidney's normal operations, and then really dig into what happens when those operations get disrupted.
Right. By exploring, the various ways kidney function can be affected, the signals the body sends out, and the approaches to diagnosis and treatment, we can hopefully give you a much deeper appreciation for these critical filters and regulators.
All right, so let's get down to it. What are the essential jobs these kidney workhorses perform when everything's running smoothly?
Well, at their core, the kidneys have several absolutely fundamental roles in maintaining our internal equilibrium, homeostasis, basically.
Let's hear them. What's first?
Okay, first, key function, filtration. You really have to imagine the kidneys as these incredibly intricate sieves constantly working within your bloodstream.
Zivs, okay.
Yeah, they're constantly filtering your blood, removing waste products, um, excess fluids, electrolytes that we don't need. And what's fascinating here is just the sheer scale, the volume of blood the kidneys process daily. It's huge. They're constantly maintaining that delicate internal environment.
That constant massive filtering capacity.
hmm
It really underscores how resilient they are, doesn't it?
It does, but also how vulnerable they become when this intricate system is compromised, even slightly.
That's incredible to think about these relatively small organs doing all that processing. It makes you appreciate how vital they are.
Yeah.
So filtration is job number one. What comes next?
The second crucial function is reabsorption. Now, this is where the kidneys really show their remarkable efficiency.
Efficiency.
How so? Well, they don't just indiscriminately get rid of everything they filter out. No, instead, they have these really sophisticated mechanisms for selectively pulling back essential substances your body still needs.
Like what?
Things like glucose, amino acids, certain electrolytes. It's a very targeted reclamation process.
So it's like the kidneys have a very specific save list, carefully grabbing valuable stuff before the rest continues on its journey out.
Precisely. This selective reabsorption really highlights the kidney's efficiency reclaiming what's necessary and discarding what isn't. It's incredibly smart.
Makes sense. Okay, filtration, reabsorption. What's the third vital function?
That would be secretion. Now, this is more of an active process.
Active, okay.
Yeah, the kidneys actively move specific substances directly from the blood into the forming urine.
Like what kind of substances?
This includes things like hydrogen ions, which helps regulate our body's pH balance, keeping it stable, also excess potassium, and even certain medications or drug metabolites.
So filtration is more like a passive straining, maybe? And secretion is an active, targeted removal. Is that a fair way to put it?
That's a pretty good analogy, yeah. This active secretion mechanism is absolutely critical for eliminating potentially harmful compounds and for really fine-tuning those electrolyte levels.
Okay, those sound like the main waste management roles: filtration, reabsorption, secretion.
hmm
But the kidneys are also involved in some important hormonal activities, right? Endocrine functions.
That's absolutely correct. They wear multiple hats. The kidneys also have significant endocrine functions. One key hormone they produce is erythropoietin.
Erythropoietin. Okay, EPO. That sounds important. What exactly does it do?
Erythropoietin plays a vital role. It stimulates the production of red blood cells within your bone marrow. Think of it as the signal, the messenger, that tells your body, hey, we need more oxygen carriers. Ramp up production.
Ah, okay. So connecting the dots.
Mm-hmm.
If the kidneys aren't functioning optimally, they might not produce enough erythropoietin,
Exactly.
and that could potentially lead to a lower red blood cell count,
Mm.
anemia. And maybe that feeling of persistent fatigue people talk about.
Precisely. If we connect this to the bigger picture, you can directly see how kidney problems can result in significant fatigue due to this reduced red blood cell production. It's one thing to read about fatigue, but I imagine for someone experiencing it because of a kidney issue, it's a completely different level of exhaustion.
Definitely makes sense. Okay, what's the next hormonal role the kidneys play?
The next crucial endocrine function is regulating blood pressure. This happens through a system known as the renin-angiotensin-aldosterone system, or RAAS for short.
RASO.
Yeah.
Heard of that.
The kidneys secrete an enzyme called renin. Renin kicks off this whole cascade of reactions that ultimately help control our blood pressure.
So the kidneys aren't just sort of passively affected by blood pressure. They actively participate in maintaining it? That's quite significant.
It really is. This illustrates just how integral kidney function is to our overall cardiovascular health. They're deeply connected.
Okay, and the last endocrine function highlighted here is the activation of vitamin D. Now, when I think of vitamin D, sunshine, maybe some foods, that usually comes to mind. How do the kidneys factor in?
That's a very common association, and it's true, we get it that way. However, the vitamin D we get from sunlight or our diet is actually in an inactive form.
Inactive.
Yeah, it needs to undergo a crucial conversion step, an activation process, and that happens in the kidneys.
Ah.
This active form of vitamin D is absolutely essential for us to absorb calcium properly in our intestines, and calcium, as you know, is vital for maintaining strong, healthy bones.
Huh. So that raises an important question, doesn't it? How often do we really consider our kidney health when we're thinking about, say, bone strength or preventing osteoporosis?
Exactly. It's definitely not the first connection most people would make, but it's a critical one.
Okay, so we've explored the remarkable functions the kidneys perform when they're healthy. Filtration, reabsorption, secretion, hormone production. Quite a list.
It is.
Now, let's shift gears and delve into what happens when things go awry, the effects of renal dysfunction. It seems like a lot of these consequences are directly tied back to those normal functions we just discussed.
Precisely. It's cause and effect. When the kidneys aren't functioning as they should, we see a disruption across the board in that delicate balance they continuously work so hard to maintain.
Okay, let's start with decreased filtration. What are the primary consequences when the kidneys just aren't filtering effectively anymore?
Well, the inability to filter properly, it really sets off a kind of chain reaction of problems. The body starts struggling to maintain its equilibrium. So this leads to things like fluid overload because the kidneys aren't removing enough excess water. You get edema, swelling.
Right.
It also causes electrolyte imbalances as a regulation of substances like, say, sodium and potassium becomes impaired. Hyperkalemia, hypotassium is a big concern.
Okay, dangerous stuff.
And finally, it results in azotemia.
Azotemia. Okay, that sounds a bit technical. What exactly is happening there?
Azotemia basically means there's a buildup of nitrogenous waste products, primarily urea and creatinine, in the blood because the kidneys aren't filtering them out effectively.
Right, so the body's waste isn't being efficiently removed and it just starts to accumulate. That sounds quite serious.
It can be, absolutely.
What about acid-base balance? Our notes mention metabolic acidosis.
Yeah, the kidneys are critical players in regulating the pH of our blood, keeping it within a very narrow, very healthy range. When kidney function declines, they often lose their ability to adequately remove acids from the body, or they can't regenerate bicarbonate properly. This leads to an imbalance known as metabolic acidosis.
And that has consequences.
Oh, yes. Over time, this disruption can have pretty far-reaching effects throughout the body. It can affect bone health, muscle function, all sorts.
Okay. We also discussed erythropoietin earlier, the red blood cell hormone. So impaired kidney function in this area means...
It means impaired erythropoietin production, which, as we discussed, directly leads to anemia, a lower than normal count of red blood cells.
And the fatigue again.
Exactly. This anemia can significantly impact a person's quality of life, leading to that persistent fatigue and weakness we mentioned.
Absolutely. Feeling constantly depleted of energy. That can have a profound effect on daily life, I imagine.
No doubt.
And lastly, impaired vitamin D activation. We touched on this earlier with bone health, but what are the direct consequences if the kidneys aren't properly activating vitamin D?
Well, without sufficient active vitamin D, the body's ability to absorb calcium from our diet is significantly reduced. This results in hypocalcemia, or low blood calcium levels. And over the long term, this, combined with other factors in kidney disease like high phosphate levels, can contribute to various bone disorders, sometimes called renal osteodystrophy or CKD mineral and bone disorder, basically a weakening of the skeletal system.
Wow, so that connection between kidney health and bone health is really often underappreciated, isn't it?
It truly is. They're linked much more closely than many people realize.
Okay, so we understand what the kidneys do and what happens when their function is impaired. Now let's explore the why behind kidney dysfunction. Our notes categorize the causes into three main buckets: prerenal, intrarenal, and postrenal.
That's a standard way to classify the causes,
Yeah.
yes. Helps organize the thinking.
Let's begin with prerenal. The description indicates it involves a decrease in blood flow to the kidneys. What are some practical, real-world examples of this? Like, what situations lead to that?
Sure. Understanding these prerenal causes really highlights how much kidney health depends on our overall circulatory system. It's all connected. So prerenal dysfunction occurs when there's simply not enough blood getting to the kidneys for them to filter properly. Common scenarios include hypovolemia.
Which is low blood volume.
Exactly. That could be from severe dehydration or maybe significant blood loss, like from a hemorrhage or major trauma.
Okay.
Heart failure is another major contributor. If the heart isn't pumping blood effectively, the kidneys just don't get adequately perfused.
Makes sense.
Sepsis, too. That's a severe body-wide infection that triggers widespread inflammation and often causes dangerously low blood pressure, which again starves the kidneys of blood flow.
Right.
And lastly, conditions like renal artery stenosis, that's a narrowing of the arteries supplying the kidneys, can physically restrict blood flow. So you can think of it like the kidneys just aren't receiving enough supply or input to do their job.
Got it. So the initial problem isn't actually in the kidney itself, but rather with the delivery of blood to it.
Yeah.
That makes sense.
Precisely. The kidney tissue might be perfectly healthy initially.
Now, what about intrarenal dysfunction? The notes say this involves direct damage to the kidney tissue.
Right. This category, intrarenal, or sometimes called intrinsic, really underscores the potential impact of things acting directly on the kidneys, medications, diseases, toxins.
Okay.
So intrarenal dysfunction refers to problems that originate within the kidney tissue itself. A significant cause, unfortunately, is nephrotoxic drugs medications that can actually damage kidney cells.
Like which ones? Are there common examples?
Yeah, some antibiotics, like aminoglycosides, are known for this. Also, NSAIDs, the non-steroidal anti-inflammatory drugs like ibuprofen or naproxen, especially with high doses or long-term use, or in people already at risk. Contrast dye used in some imaging can also be a cause.
Wow, even common drugs.
Yep. Then there's glomerulonephritis, which is inflammation of the glomeruli, those tiny filtering units in the kidneys. That can be caused by infections or autoimmune diseases. Acute tubular necrosis, or ATN, is another big one. This involves damage specifically to the kidney's tubules, often triggered by prolonged lack of blood flow ischemia or exposure to toxins. And of course, infections of the kidney itself, like pyelonephritis, also fall into this intrarenal category. So in these situations, the kidney tissue itself is the site of the injury.
Okay, so in this case, the kidney tissue itself is the primary problem. Yeah. Now let's move on to the third category, postrenal dysfunction. This is described as an obstruction of urine flow after it leaves the kidney.
Exactly. Postrenal. Think after the kidney.
So what kinds of things can block the urinary tract?
Well, this category emphasizes that problems occurring downstream from the kidneys can back things up and significantly impact their health.
Like a plumbing issue?
Sort of, yeah. Postrenal dysfunction happens when there's a blockage somewhere in the urinary tract that prevents urine from draining properly out of the kidneys. Kidney stones are a relatively common cause, getting stuck in the ureter, the tube leading from the kidney to the bladder.
Ouch. Yeah.
In men, an enlarged prostate, BPH benign prostatic hyperplasia, is a very common cause. It can compress the urethra, the tube leaving the bladder, making it hard to empty and causing urine to back up.
Okay.
Tumors, either in the bladder, prostate, ureters, or even outside pressing on the urinary tract, can create blockages. And things like ureteral strictures, which are narrowings of those tubes, maybe from scar tissue, can also impede the flow of urine.
So it's like the exit route is blocked, causing a backup of urine and increasing pressure on the kidneys.
That's exactly it. That backup pressure, called hydronephrosis, can damage the kidneys over time if it's not relieved.
Right, like a traffic jam on the way out, causing problems all the way back at the line. Okay, so we've covered the three main categories of why kidneys might not function correctly. Prerenal, not enough blood flow in, intrarenal damage within the kidney, and postrenal blockage on the way out.
That's the framework.
Now, how does the body signal that something is amiss? What are the telltale signs and symptoms of kidney dysfunction? What should you look out for?
Well, the tricky part is that some symptoms can be quite general or nonspecific, especially early on. This nonspecific nature really highlights why awareness is so important and why you need proper medical evaluation if things seem off.
Okay, so what are some of those general signs?
The body can present with a variety of signs when the kidneys are struggling. Some common general symptoms include persistent fatigue and weakness. We link that to anemia, but it can also be from the buildup of waste products. Edema, which is swelling, particularly noticeable in the legs, ankles, feet, sometimes even around the eyes, can occur due to that fluid retention we talked about.
Right.
Changes in urination patterns are a big clue. Either a significant decrease in urine output that's oliguria, or even no urine anuria, or sometimes, paradoxically, needing to urinate more often, especially at night.
Interesting.
Hypertension, high blood pressure is very commonly associated with kidney problems. It can be both a cause and a consequence of kidney disease. Nausea and a loss of appetite, sometimes called anorexia, can arise from that buildup of metabolic waste products, uremia. In more severe cases, as uremia worsens, confusion or difficulty concentrating can develop. That's the waste products affecting brain function.
Wow.
And some individuals might experience persistent pruritus, that's just itchy skin and noticeably dry skin. Again, often related to the buildup of substances that healthy kidneys would normally filter out. These are all ways the body might be trying to signal that something isn't quite right with the kidneys.
Those are some fairly general symptoms, though. Fatigue, nausea, swelling. I can see how they might sometimes be overlooked or maybe blamed on something else entirely.
That happens quite often, unfortunately.
Are there any more specific findings that might point more directly towards a kidney-related issue?
Yes, definitely. There are certain findings that can provide more specific clues and should really raise a red flag. Proteinuria, that's finding excessive protein in the urine, is a key one. And hematuria, which is blood in the urine. It might be visible, making the urine look pink, red, or cola-colored, or it might only be detectable under a microscope. Both protein and blood in the urine often strongly suggest a problem with the glomeruli, those filtering units within the kidneys.
Glomerular issues, right?
Also, flank pain, that's pain felt in your side or back, sort of below the ribs where the kidneys are located, can be indicative of a kidney infection like pyelonephritis, or perhaps a kidney stone causing an obstruction and stretching the kidney capsule.
Mm-hmm.
And another one people might notice is foamy or bubbly urine. That can be another sign of significant protein loss in the urine as the protein changes the surface tension.
Foamy urine. Interesting.
Yeah. So the presence of protein or blood in the urine especially is generally considered a significant indicator of potential kidney problems that definitely warrant further investigation.
Okay, so if someone is experiencing some of these general symptoms, or maybe notices one of those more specific signs, what kind of tests and assessments might healthcare professionals use to figure out what's really happening with their kidneys?
There's a range of valuable diagnostic tools available, and they really provide crucial insights into both how well the kidneys are functioning and their physical structure.
Right, function and structure.
Yeah.
What tests look at function?
In terms of laboratory tests that assess function, measuring the levels of BUN, blood urea, nitrogen, and creatinine in the blood is fundamental. These are waste products, so elevated levels can be a strong indicator that the kidneys aren't filtering them out properly.
BUN and creatinine, got it.
Then there's the glomerular filtration rate, or GFR. This is a really vital measure. It estimates how effectively the kidneys are filtering waste from the blood, usually calculated from the creatinine level along with age, sex, and race.
And there's a threshold for chronic kidney disease, right?
Yes. A GFR consistently below 60 millilena, 1.73 meters offs, for a period of 3 months or longer is the defining characteristic of chronic kidney disease, or CKD. Monitoring GFR over time is crucial for assessing the progression of kidney disease.
Okay, what about urine tests?
Urinalysis is another essential test. Just analyzing a urine sample can tell you a lot. It can detect the presence of protein, blood, white blood cells indicating infection or inflammation, and things called casts, which are like microscopic molds of the kidney tubules that can give clues about intrarenal problems. Checking electrolyte levels in the blood is also routine. As kidney function declines, imbalances like hyperkalemia, hypotassium, hypocalcemia, low calcium, and hyperphosphatemia, high phosphate, can occur, and these need managing.
So blood and urine tests give a good picture of kidney function. What about imaging techniques to see the structure?
Exactly. Imaging studies let us actually visualize the kidneys and the surrounding urinary tract. Ultrasound is very frequently used as a first step. It's non-invasive, uses sound waves, and it's great for detecting obstructions like kidney stones or hydronephrosis, and for assessing the size and shape of the kidneys.
Okay.
CT scans and MRIs can provide much more detailed images. They're particularly helpful if doctors suspect masses, tumors, complex cysts, or certain types of kidney stones. Sometimes contrast dye is used, but carefully, given the potential nephrotoxicity we mentioned.
Right.
And in some specific situations, particularly if the cause of kidney disease isn't clear from blood, urine, and imaging tests, a renal biopsy might be necessary.
A biopsy, taking a piece of the kidney.
Yeah, a small sample of kidney tissue is obtained using a needle, usually guided by ultrasound or CT, and then it's examined under a microscope by a pathologist. This can be really crucial for diagnosing specific glomerular diseases or other conditions affecting the kidney tissue itself.
Okay. And are there any other types of tests that might be used?
Yes. Sometimes a 24-hour urine collection is done. You collect all your urine over a full day, and this allows for a very precise measurement of creatinine clearance, which is another way to assess how well the kidneys are filtering creatinine. It can sometimes give a more accurate picture than a single blood test GFR estimate.
Mm-hmm.
And if there's a suspicion of a blockage or problem emptying the bladder, like with postrenal causes, a simple bladder scan using ultrasound can measure the post-void residual volume. That's the amount of urine left in the bladder right after you urinate. A high residual volume suggests incomplete emptying.
So a pretty comprehensive set of tools to really help pinpoint what's going on with the kidneys.
Definitely. Combining these tests usually gives a clear picture.
Now, if a kidney problem is diagnosed, what are the typical approaches to treatment? What can be done?
Well, the key thing is that treatment strategies are highly individualized. They really depend on the specific underlying cause, whether it's prerenal, intrarenal, or postrenal, the severity or stage of kidney dysfunction, and whether the problem is acute or chronic.
Right, tailored treatment.
Exactly. Pharmacologically, a fundamental principle, especially with existing kidney issues, is to avoid or very carefully manage any potentially nephrotoxic drugs. That's step one, do no further harm.
Makes sense. What about non-drug treatments?
Non-pharmacological treatments play a huge role. For managing fluid overload, diuretics, often loop diuretics like furosemide, are commonly used to help the kidneys excrete excess salt and water.
Okay.
Controlling blood pressure is critical. Antihypertensive medications, particularly classes like ACE inhibitors and ARBs, are frequently prescribed. They not only lower blood pressure, but in many cases also have a protective effect on kidney function, especially in people with diabetes or proteinuria.
Ah, dual benefit there?
Yeah. For individuals progressing into chronic kidney disease, managing the complications becomes key. Phosphate binders might be needed to control high phosphate levels, and calcium or activated vitamin D supplements might be necessary to manage the complex mineral and hone disorders, the CKD-MBD, that can arise.
Right, addressing those downstream effects.
Exactly. For the anemia associated with CKD, those erythropoietin-stimulating agents, ESAs, can be used to boost red blood cell production. And if metabolic acidosis is significant, sodium bicarbonate might be administered orally to help correct the acid balance.
Okay. And what about for more advanced stages of kidney disease when function is really low?
Right. In cases of severe kidney failure, when the GFR drops very low, you get into renal replacement therapy. Dialysis becomes a life-sustaining treatment.
Dialysis. How does that work, briefly?
There are two main types. Hemodialysis uses a machine, an artificial kidney, to filter the blood outside of the body. This is typically done at a dialysis center several times a week for several hours each time.
Okay.
The other main type is peritoneal dialysis, or PD. This uses the natural lining of your own abdomen, the peritoneum, as the filter. Dialysis fluid is introduced into the abdominal cavity, dwells there for a while to draw out waste and fluid, and then drained. PD can often be done at home, sometimes overnight while sleeping.
Interesting. Different options there.
Yes. And ultimately, for end-stage renal disease, ESRD, which is stage 5 CKD, a kidney transplant offers the best long-term outcome and quality of life if the person is a suitable candidate. That involves surgically implanting a healthy kidney from a living or deceased donor.
The definitive treatment, really.
For ESRD, yes.
Yeah.
And I absolutely have to mention dietary management. It plays a critical role in managing kidney disease at almost all stages.
Diet. How so?
This often involves carefully regulating the intake of certain nutrients. Usually, a low-sodium diet is key for blood pressure and fluid control. Depending on the stage and lab results, there might be restrictions on potassium and phosphorus intake. Protein intake might also need adjustment, sometimes restricted to reduce waste load, sometimes needing to be adequate to prevent malnutrition. Fluid intake might also be restricted in later stages. It's very personalized.
That sounds like a lot to manage.
It can be, which is why working with a renal dietitian is often very helpful.
Okay, that's a wide spectrum of treatments, really underscoring the complexity of managing kidney-related illnesses. Now, our notes highlight a crucial distinction between acute kidney injury, AKI, and chronic kidney disease, CKD. Could you clarify the key differences between these two? They sound similar but seem quite different in nature.
They are very different, and it's a really important distinction to understand. Maybe think of AKI as a sudden, often unexpected crisis, while CKD is more like a long-term, slow-burning condition.
Okay, sudden crisis versus slow burn. I like that. Tell me more about AKI.
Okay, acute kidney injury, or AKI, has a rapid onset. It develops quickly over a period of hours to maybe days. The potentially encouraging aspect of AKI is that if the underlying cause, like dehydration or a drug reaction or temporary blockage, is identified and addressed promptly, kidney function can often recover, sometimes fully.
So potentially reversible.
Often, yes, especially if caught early. AKI typically progresses through several phases. There's an initial injury phase, then often an oliguric phase where urine output drops significantly, followed by a diuretic phase where urine output actually increases as the kidneys start to recover their filtering ability, but maybe not their concentrating ability yet, and finally, hopefully, a recovery phase where kidney function gradually returns towards the person's baseline. Common causes of AKI, as we touched on, include those prerenal issues like severe dehydration or shock, direct kidney insults like nephrotoxic medications or severe infections, and sometimes postrenal obstruction.
So AKI is more of an immediate crisis, but with the potential to resolve if managed right. What about CKD then? The slow burn.
Exactly. Chronic kidney disease, or CKD, in contrast, is typically a gradual and unfortunately irreversible decline in kidney function that develops slowly over months or usually years.
Irreversible. That's the key difference.
That's the key. It's defined, as we said, by that GFR below 60 millimin 1.73 meters lasting for more than 3 months. Or other evidence of kidney damage like persistent proteinuria, indicating a sustained loss of kidney function.
And it has stages.
Yes, CKD is classified into 5 stages based on the GFR level. Stage 1 is kidney damage with normal or high GFR, while stage 5 represents end-stage renal disease, or ESRD, where the GFR is very low, usually below 15, and renal replacement therapy, dialysis, or transplant is typically needed for survival. And over time, as CKD progresses, it leads to that whole range of significant complications we discussed. Anemia, metabolic acidosis, bone disease, CKD, MBD, and a significantly increased risk of cardiovascular disease. In fact, cardiovascular problems are the leading cause of death in people with CKD.
Wow. Okay, so AKI, sudden onset, often reversible, distinct phases.
Yeah.
CKD, gradual, irreversible, progressive stages, long-term complications. That's a clear and really important difference.
Absolutely crucial difference in terms of prognosis and management. Early recognition of AKI is key to improving chances of reversibility. Managing CKD is focused on slowing the progression, managing the complications, and eventually preparing for renal replacement therapy if needed.
Right. Finally, our notes briefly touch upon special considerations for older adults and children concerning kidney issues.
Whoa.
What are some of the unique aspects to be aware of in these populations?
Yeah, age definitely plays a role. Age-related physiological changes and the specific health challenges faced by children mean we need a bit of a tailored perspective.
So for older adults?
Well, older adults are generally at a higher risk for developing kidney problems, both AKI and CKD. This is partly due to a natural decline in GFR that can occur with age, but also because they have an increased prevalence of underlying conditions that affect the kidneys, like diabetes and hypertension. Plus, older adults are more likely to be on multiple medications polypharmacy, which increases the risk of drug-induced kidney injury or interactions affecting kidney function. Their kidneys may also be less resilient in recovering from insults like dehydration or infections.
Okay, increased vulnerability there. What about children?
In children, while less common than in adults, kidney issues can certainly occur. Sometimes these are related to congenital anomalies, structural abnormalities of the kidneys or urinary tract that were present at birth.
Right from the start.
Yeah. Children can also develop specific kidney conditions like nephrotic syndrome, which is characterized by really heavy protein leakage into the urine causing significant swelling, or certain types of glomerulonephritis. Diagnosing and managing kidney disease in children requires specialized pediatric nephrology care.
So it's really crucial to take these different stages of life into account when thinking about diagnosing and managing kidney health.
Absolutely. Providing age-appropriate care, being mindful of comorbidities in older adults, looking for specific conditions in children, it's all essential for managing kidney health effectively across the entire lifespan.
Well, this has truly been a comprehensive deep dive into the fascinating and clearly vital world of our kidneys.
It's a complex topic for sure.
Yeah, just to quickly recap for everyone listening, we've learned that the kidneys are absolute powerhouses, essential for filtering waste, reabsorbing vital substances, secreting certain compounds, and producing crucial hormones like erythropoietin and active vitamin D.
The core functions.
We explored how kidney dysfunction can arise from issues before the kidney, prerenal blood flow,
Right.
within the kidney, intrarenal damage, or after the kidney, postrenal obstruction, leading to a wide array of symptoms, some general, some more specific.
Right, the causes and signals.
We looked at the key tests used to diagnose these problems. Blood tests like BUN, creatinine, GFR, urine tests, imaging like ultrasound and CT, and the various treatment options available, from medication and diet to dialysis and transplant.
Diagnostics and treatments, yeah.
We also clarified those critical differences between the sudden crisis of acute kidney injury, AKI, and the slow progressive challenge of chronic kidney disease, CKD, and touched on some special considerations for older adults and children.
Good summary.
So what does all this detailed information mean for you listening? Hopefully this deep dive has really illuminated the incredible, often overlooked work our kidneys perform every single day and maybe provided you with a much clearer understanding of what to be mindful of regarding your own kidney health.
Yeah, I think this kind of in-depth overview really highlights the intricate nature and the profound importance of kidney health. And importantly, how seemingly diverse symptoms like fatigue, bone problems, high blood pressure can actually be interconnected through kidney function or dysfunction.
Absolutely. Which leads to a final thought to leave you with. Considering the multitude of factors we discussed that can influence kidney health, from blood pressure and blood sugar to medications and hydration, what are some everyday habits, maybe things you do without even thinking that you might not realize, could be subtly impacting your kidneys over the long term? It's definitely something to ponder and maybe worth a conversation with your healthcare provider.